This part of the presentation on cocaine addiction will focus on three categories. First is interventions, including both pharmacological and behavioral, dual diagnosis issues, including things like depression and anxiety, and social responsibility, meaning just what is our job as citizens when it comes to helping to combat the issue of addiction here in America. This second slide will focus on 4 points that I found to be interesting. Most recently, in 2016, cocaine use accounted for 6% of drug rehab admissions. Now, I know that number seems kind of low, but cocaine is what we call a polysubstance abuse issue, where they're not only using cocaine in some form or another, but they also are using another drug, such as a downer, like heroin, to bring them down from the high that they were experiencing, um, something like marijuana, even alcohol. Smoking crack seems to be the entry point of choice among users who are maybe just starting out or have no other way to buy more expensive forms. Smoking it, from my research, is the cheapest way, all the way up to snorting, which seems to be the most expensive way to ingest cocaine, because according to what I read, you're getting it in its most purest form. Um, Treatment providers recognize this as a complicated issue. So it's not just an issue where we have changes in the brain, but also physical, mental, and family impacts as well. Now we'll discuss here in the coming slides some of the mental impacts when we get into things like dual diagnosis. Cocaine use is often associated with some form of mental health concern. Not that cocaine use causes things like depression or anxiety. Let's just say you have something like schizophrenia, or maybe some of the issues like bipolar, or a brain function issue like a personality disorder. Um, that symptomology alone, um, the symptoms, the side effects from the pharmacological meds that you're taking, might drive some of that behavior. Now, oftentimes, I have had clients who can't afford the psychotropic medications because they don't have insurance or they don't have access to it. So to combat some of the symptomology from something like, per se, schizophrenia, where you're hallucinating or hearing voices, to get some relief from some of those troublesome issues, people often will turn to street drugs. Currently, there is no specific medication to treat the use of cocaine. However, the medication used to treat alcoholism, known as disulfiram, has shown some promise in working on the emotion and reward center of our brain. Now, cocaine impacts what we call neurotransmitters, most predominantly the dopamine, which is the reward or pleasure seeking side of our brain. Also, serotonin and norepinephrine are on the research table as well, to see what additional scientific facts they can generate from that type of research to focus on maybe some of those receptors as well. Interestingly enough, there is a vaccine that is out there for the treatment of cocaine. However, it is not very effective. Only 30% of users did not go into relapse, which means you have 7 out of 10 users that at some point after receiving this vaccine have either started using again in one way or another. Now, there was no research out there or information to show if they went back into treatment or not, or if you can get this vaccine more than once. Um, right now, the pharmacological approach does not seem to be the most effective. So why don't we talk about some behavioral interventions? Now, as a clinical mental health practitioner, I would say I'm probably more well versed in behavioral types of interventions. These can take place both in residential and in outpatient settings. A lot of the residential treatment facilities I've seen around here that I have had personal experience with my caseload usually last anywhere from 2 weeks to 28 days. There are some long-term facilities, not really in this area, but people who I have known who have gone to them, from 6 months to over a year long. Now getting into some of the actual mental health therapy, something called cognitive behavioral therapy, or CBT. It's a way to restructure the thinking patterns of our brain, the maladaptive patterns of behavior that kind of drive the people to continue to use and seek that reward and that pleasure system in the brain. So we help to kind of restructure some of those thoughts and push them in a healthier direction. Something like Cocaine Anonymous, which is just one of your basic 12-step programs. Therapeutic communities, which I know we did discuss in class. It is a more rigorous peer-based approach from my understanding, where there are facilitators. However, a lot of the people there, the clients per se, really held or they hold each other accountable. And so it seems to be very effective. I've known a couple people who have gone through that as well. Lastly, something called contingency management. This focuses on what again was speaking of that dopamine receptor, the reward center of our brain, where it focuses on tangible items or incentives, um, effective at treating the initial abstinence. So the first time you go in for treatment, you may get something like a ticket system or a token system. You get a free gym membership or a free gas card. And again, that's just to try and see if that particular individual can change the way they think. They're still getting something, a reward. It's still focusing on that reward and pleasure center, the emotional reward center of the brain, although it is a much more effective and a much more healthier outcome. I'm going to speak just very briefly on four mental health diagnoses. Now, there are a lot more we could talk about, but in the essence of time, let's talk about four that are probably the most prevalent. Number one is an anxiety disorder. Now, as I said previously, cocaine use does not mean that you're going to develop an anxiety disorder. If you have an anxiety disorder, you won't necessarily become a cocaine addict. So they're not mutually exclusive, although they do and they can sometimes go together. So continued use of cocaine can lead to things like paranoia, racing thoughts, being worried or nervous, hallucinations, seeing things or hearing things that are not there, insomnia, having trouble sleeping, falling asleep, staying asleep, and an increase in violence. So that's just outward acts of aggression or rapid elevated changes in mood. Depression disorder, a loss of relationships due to maybe stealing or people who just don't understand it and they don't want to be a part of it. A loss of finances, social supports, and a loss of self, not really knowing who you are anymore. Post-traumatic stress disorder is something that can drive people to use substances because they don't have the coping skills to know how to deal with the trauma that is in their brain, the resulting racing thoughts or feelings that they're having, and they just want to turn their brain off. Something like a personality disorder, more especially narcissism. Cocaine provides and reaffirms the inflated sense of self that comes along with narcissism, and this increases the chance of risk-taking behaviors. So not only are there mental health issues, emotional problems, but now you're getting into high-risk behavior, which is dangerous to your body and your physical well-being as well. I'll speak just very briefly on social responsibility. I did find something called the Listen campaign, sponsored by the Ad Council and Viacom. It is a way to communicate and get the information out there that this is an issue that we can't no longer ignore, um, and we're not to be judgmental. We're trying to be understanding. We're trying to say, hey, if you have a problem, I'm a person you can come and talk to. Or I understand you have an issue. Let's figure out who you can go and talk to get yourself some help. Now you'll see at the bottom here to listen.com is the website associated with this campaign. And on the following slide, I believe there is a very short 15-second teaser clip that just kind of gives you some insight onto what this campaign is all about. So if you want to go ahead and take a look at that, you may. And this ends my portion of this presentation on cocaine addiction.
Hi, I will be presenting the next section of our presentation, starting with the different routes of administration of the drug cocaine. So the effects of cocaine on the body were first noticed in 2500 BC as native cultures in Peru began using the coca leaf by chewing it for its effects of suppressing the appetite, fighting fatigue, increasing endurance, and then enhancing their social occasions. It was also ground up and placed on the gums for those same effects. This administration of the drug has the lowest cocaine blood levels due to the coca leaf also being combined with many other chemicals other than cocaine hydrochloride. The next route of administration started occurring in the 1860s after the isolation of cocaine hydrochloride from the coca leaf. This was 200 times more powerful than the coca leaf and allowed the drug to be dissolved and used in drinks. And so by the late 1816, cocaine wines became popular, and then eventually Coca-Cola was introduced as a drink that would relieve mental and physical exhaustion. So then after that, in the late 1800s, cocaine was being used in minor surgeries by a physician as a topical anesthetic. But physicians were unaware of the overdose potential, and then many of those that were treated with this type of anesthetic died. This route of administration is also the highest blood cocaine level and leads to a very intense rush by the user within only 30 seconds of the injection. So after the injecting of cocaine in the early 1900s, snorting cocaine became really popular, and it's also known as tooting, blowing, or horning. This route is the quickest to reach the brain in only 3 to 5 seconds. And so the absorption happens quickly as it is snorted through the nose. But it does become slower and slower the more that the drug is used because the nasal capillaries constrict over time, and so you'll see the effects kind of hit the user later. Then in the 1970s and 80s, cocaine hydrochloride was converted to a free base cocaine, making it able to be smoked. And then this led to just another major epidemic of cocaine use. But this route of administration is very desirable among the users because it delivers cocaine to the brain in as little as 5 to 8 seconds. And so these are the 5 different routes of administration that are commonly used today. So this next slide is going to be talking about the neurological effects of cocaine use, and I'm going to be talking about a process called synaptic transmission, where neurotransmitters are transmitted from a presynaptic neuron to a postsynaptic neuron. And the natural process begins when dopamine and other neurotransmitters are released from one neuron, the presynaptic neuron, and then they bind to the receptors of the postsynaptic neuron. After this occurs, dopamine is returned to the first presynaptic neuron for reuse. And so that's the natural process. But when cocaine hydrochloride enters the brain through whatever route of administration the user chooses, dopamine is unable to return to the presynaptic neuron as the cocaine molecule blocks the ability for dopamine to be recycled. And so what happens then is that this causes a buildup of neurotransmitters in the brain, causing this very euphoric effect for the user. So following the use of cocaine, the user may experience something called a crash, and this is due to the rapid depletion of neurotransmitters to compensate for that excess that was occurring while the cocaine was blocking that reuptake. And so that is why those effects occur physiologically for the user. So this next slide will deal with the physiological effects of cocaine use, or just the ways that the body responds to this drug. So what we know is that body functions are greatly altered through the use of cocaine, and you'll see some short-term and long-term effects. The short-term effects include the loss of appetite, increased heart rate, blood pressure, breathing, and body temperature, dilated pupils, hallucinations, erratic or aggressive behavior, increased sex drive, which you'll notice is the opposite of long-term effects, delayed ejaculation, and interrupted sleep patterns. And so those are the shorter-term effects of this drug. Now, for long-term, when an addiction has occurred and the body has been experiencing this drug for a long time, cocaine causes chronic high blood pressure, which can also lead to stroke or heart attack, damage to the blood vessels of the heart and the brain, damage to the liver, kidney, and lungs, damage to the reproductive system, and then sexual dysfunction. And so those are some of the short and long-term effects of this drug. This slide will talk about the developmental effects of cocaine use. And so developmental effects of cocaine mostly occur for babies exposed to the drug in utero. So some of the neonatal effects on the fetus include kidney defects, heart defects, placental abruption, low birth weight, small head circumference, and premature birth. After the baby's born, some studies have suggested that mild or greater mental delays are double that of infants not exposed to the drug. And there are some studies that have found that these infants and toddlers struggle with hyperactivity and delayed cognitive and language development. However, in many of the studies, it's unclear whether these are accurate due to many of these children being exposed to other environmental factors such as neglect. And so we want to make sure we take that into account when we're studying the developmental effects on babies for cocaine use. And so for most young children up to the age of 6, what's been found is that minimal effects are seen when looking at physical growth, cognition, language skills, motor skills, and other behavioral issues that were thought to be a concern. This suggests that many children exposed to cocaine in utero outgrow these effects or learn alternate methods of progressing forward in their learning. So this next slide is one that will talk about spiritual issues for cocaine users. For those dealing with addiction to cocaine, there's most likely a subconscious understanding that something's wrong, that something's not right. And so this emotional pain leads the user to more drug use in order to dull the mind. And in Addictions and Grace by May, it states that he must always keep his mind either occupied or dulled so that no clear space opens within which the conscious realization might occur. And so common to those beginning to struggle with addiction is a denial that there's a problem, repression of deeper issues, and rationalization of the drug use. And so this is a type of hiding, and so the drug is just hiding the user. And this hiding leads to spiritual issues as emotional issues are kept in the dark. And Scripture teaches in Ephesians that everything exposed by the light becomes visible, and everything that is illuminated becomes a light. So when the individual continues to keep their struggles in the dark, they are not able to allow the Spirit of God to enter or a higher power to take control of their life at all. Additionally, the loss of self-control is a big issue, and the individual struggling with addiction experiences this loss of self-control due to neurological effects of the drug causing this dependence. From a Christian standpoint, we know this as idolatry. They've been mastered by cocaine, which turns into an idol and stands in the way of God, not allowing the Spirit of God to enter. And so these are some of the spiritual issues that I've come up with from more of a Christian standpoint.
Impacts cocaine has for family and social development. When a family member has a drug or alcohol addiction, that addiction has the power to affect and hurt the entire family. That addiction can cause high levels of stress, miscommunication, and tension within the family. Family members and sometimes even friends may have to take on greater responsibility of that person that has the cocaine addiction. The repercussions of addiction can linger for generations. I'll speak more about cultural, gender, and age differences regarding treatment on slide number 7. The use of cocaine can be medical, and what I mean by medical, what I learned through research is if you mix cocaine, probably not like raw cocaine, but you can mix cocaine with other substances, and you can come up with a medical type substance that would treat depression, tuberculosis, asthma, and even gastric disorders. Cocaine can be used recreational. Cocaine can be done via chewing it, drinking it, injecting it, or snorting it. Cocaine use has adverse effects. It has acute, chronic, and addictions. Whether you use cocaine for a short time or an extended period of time, the consequences of lasting effects is a sure thing. Like I said, it doesn't matter if you just try it once or if you try it over a long period of time, you will eventually develop some adverse effects. We have chronic effects, which is an ongoing cardiovascular issues, movement disorders, and even the onset of Parkinson's disease. You have acute effects that include things like headaches and even transient loss of consciousness. You have also as effects nervous system, violence, sexual effects. These are all among some of the mental and physical impacts of cocaine use. Signs of addiction. Addiction occurs when the compulsion to keep using kicks in. Signs of addiction could be isolation from family and friends, depression, psychosis, and paranoia. Some obvious signs of addiction are risk-taking, neglect and abandonment of responsibilities, and continued use despite negative consequences. A short history on cocaine. Cocaine is derived from the coca leaf. Coca is one of the oldest and most potent and most dangerous stimulants of natural origin. 3,000 years before the birth of Christ, ancient Incas in the Indies, they chewed the coca leaves, and they chewed these coca leaves to get their heart racing and to speed up their breathing as a means to the counter effect of them living high up in the mountains. Cocaine was first extracted from the coca leaf in about 1859 by a German chemist named Albert Niemann. It was in the 1880s that it hit the medical community. From the 1850s to the early 1900s, the drug started being used by people of all social classes. By the year 2018, cocaine had become the second most trafficked illegal drug in the world. The impacts that cocaine has for families and social development is absolutely fatal. When it comes to society and culture, you think about treatments. And when you think about treating someone with a cocaine addiction, cultural, gender, age, and psychological makeup may play a part in how that addicted person may be receiving treatment. The cultural, gender, and age difference that might influence how I relate to and treat a client addicted to cocaine with results of different psychological makeups and the fact that addictions affect individuals, personalities, and behaviors in different ways. The most important aspect of my treatment plan would be that everyone is an individual. They are their own unique self, and there's no other like them. So it's not possible to have a one-size-fit-all type treatment. So, but what is common is no matter what the culture, gender, or age difference is, the compulsion involved, I'm sorry about that noise, the compulsion involved in the steps between abuse and addiction, this is the area of healing I would be concentrating on. I'd like to thank you for your time and your patience, and I'd like to leave you with this word of encouragement, if I might, in closing. We are to honor and esteem others because they are valuable in the eyes of God. When we see others as valuable the way God sees them, and this includes anyone, people with addictions, people that don't have addictions, people that are Christians, people who don't think of themselves as Christians, it doesn't matter. We should always be careful in the way we talk to others. We should look for the good in them and honor them for who God made them to be, even if they don't realize who it is they were meant to be. We should choose to esteem and delight in one another. Again, thank you very much for your time and patience. Have a blessed and peace-filled evening. Thank you.